I'm Dr. K K Talwar. I'm presently chairman Department of Cardiology, Max Healthcare Institution. ये जो आप थोड़ा पब्लिक की अवेयरनेस के लिए जो इश्यूज हैं, पर्टिकुलरली हार्ट का, एक तो आई एम श्योर gradually people are realizing heart diseases are becoming like an epidemic with us in the country. I think earlier when after independence it was started, it was more of communicable diseases, malaria hai, tuberculosis hai. But now for the last 3 decades or so, there is a more awareness also regarding the lifestyle related disorders. जैसे diabetes कहते हैं कि हिंदुस्तान तो world की capital है. I mean there are probably will have 40-50 million patients with diabetes. Blood pressure is also similarly common. Heart attacks. You see, और एक फैक्टर जो कि इम्पोर्टेंट है साउथ एशियंस में, इंडियंस और एडजॉइनिंग जो कंट्रीज हम कहते हैं जैसे पाकिस्तान, सीलोन है, बर्मा है, नेपाल है, we get this heart attacks or this kind of problems at a younger age than what is seen in Europe or North America. So I mean that's all. Yeah, I mean, we now see younger coming around 30s with heart attacks, which is something was not sort of thought of. Another thing is that it was always said heart attacks वगैरह तो ये तो कुछ affluent community की होते हैं, वो भी नहीं fact. Middle society, even lower middle society is also getting heart attacks, and they say 80% burden of the world is in the low and medium sort of societies, countries which are considered like low income or middle income countries. So I think so it is at the same time we should realize that okay, treatment is important and there are helps where people should get aware of if there is any problem, where to go, and so that you can get early treatment. Another important factor in this is the prevention, that you can prevent these problems. If you we say they are all lifestyle related disorders. People stopped exercising, food has become unbalanced, like a junk kind of a food, which is a lot of rich in fats, trans fatty acids. Then smoking is another major issue, particularly in youngsters. When you see patients coming in with heart attack around 30s, most of them are smokers. So, and then other issues, alcohol is excess is another issue. So I mean these are the, then I think the unbalanced diet gives you overweight, that makes you prone to hypertension, to diabetes and heart attacks, even strokes. So I think if we realize that exercise is important for the body, eating a balanced food is important for the body, smoking is not compatible with a healthy body, or even alcohol also, occasionally as a social drink is okay, but not it when people try to cross those safe limits which causes it. And ये भी थोड़ा सा कही आता है न्यूज़पेपर्स में नहीं जी अल्कोहल इज गुड फॉर द हार्ट, ऐसा नहीं है. अल्कोहल स्मॉल क्वांटिटी में मे बी इट्स लाइक अ ट्रैंक्विलाइजर, बट नथिंग इफ यू गो स्लाइटली बियॉन्ड it's going to harm the body. Suppose if somebody gets discomfort, particularly cardiac issue, that if you get chest pain, you should not try to ignore. You may go to your doctor, check it. Because yes, many chest pain can be non-cardiac, but cardiac pain is also you can't be able to differentiate. So I think whenever you have some chest discomfort, particularly on walking, or discomfort which gives you some breathing issues, difficulty, or sweating, and along with that, do try to go to the nearest doctor and get him examined. So then, if need be, we can refer you to the bigger centers. But if you ignore it, and suppose younger people, somebody gets a heart attack, we always for the first few hours of the golden time. I mean, sometimes 50% of the death in acute heart attacks occur within the first 4 hours. And if you are not really sure, you're not able to, sometimes you try to ignore also. That maybe tummy issue, let me take some Delucil, let me take some other medication. You try that, but important thing that if it's persisting, you should not ignore it.